All right, Doc. I'm here for my acupuncture appointment.
Excellent. Hey, everyone. This is an active podcast today, right?
This is a special edition where I'm going to sit here, get acupuncture, get needles.
The guinea pig.
Yeah, this is the experience that I get in your office that I was like, let's actually show them. So if you're listening to this podcast, we also are showing it on our YouTube channel. Basically, what is acupuncture all about? What's the experience like when you come to Dr. Dummar's office? And whether folks are local or if they're listening or watching somewhere else, maybe it just helps them understand more about something, because I know a lot of people are just afraid of needles.
Yeah, I'm going to walk off screen and plug something in real quick.
So what happens when I show up is you have a little form here, your community acupuncture treatment record. You say, what is your complaint or symptom? And then you list a lot of benefits like anxiety, arthritis, chronic pain, depression, insomnia, nausea, stress, and anxiety. I mean, I know one thing. I always feel more relaxed when I go to acupuncture.
Yeah, so the last thing people typically think is that when they go to acupuncture and have needles put in their body, they're going to feel more relaxed. They're going to feel better.
Right.
Usually people are thinking just the opposite. Why would I ever let somebody put needles in my body? Well, our experience with the way acupuncture works on the brain and the nerves is it actually does balance the autonomic nervous system. It releases and mitigates our stress hormone. So our body's able to relax and function more optimally.
Now, we just put this room divider here. I can tell you in person, this room is dimmer when you show up. You play really nice music. It's a community setting with a handful of chairs. Yeah, we have usually about 7 to 8 chairs. The vibe is very nice. I don't know, it's a weird thing to say if you're looking at this, but just this is where we do acupuncture, and it just has a feeling to it. If rooms can have an energy, this has a very nice calming. We try to have more calm lighting, better mood, not so much bright overhead lights, that people would think, oh, that's really sterile and too bright. So we want the mood to be really calm and relaxed. And basically, the lower lighting helps also with your autonomic nervous system, helps people get into more of the rest and digest type of relaxation mood. So we want people in the ultimate state of healing, which is resting. Okay? So what I'm going to do, like you mentioned, you have written down your complaints. You got a lengthy list of complaints there, buddy. So you've written down your list of complaints, and I'll assess those, and I look at it, and then I create essentially a plan. So I'm creating a formula for how we're going to address the complaints that this patient has presented with today. And then what I'll do is I'll get the needles, we'll insert them, we'll clean the areas that the needles are going to go into, and then we'll insert those needles and we'll let you rest for about 15 to 20 minutes. So that's probably not going to happen 20 minutes on this, but maybe we'll You'd be surprised,
speed through
though.
that.
You'll be surprised. Can I talk while I'm getting
You go right
acupuncture?
ahead.
All right, so I came in today having a lot of anxiety, and I have shoulder pain. I have no idea what he does, right? I'm the patient. I'm here to say, give it your best shot, doc. Like, needles, acupuncture, does this really work? Let's see what he's got for me. Now, what do you think is instructive for people at home to know about what happens when I tell you that? How much do I need to know, or what is your plan? Like, tell me it's more than just putting a needle in my skin and hoping something happens.
Yeah, so the assessment, we know, okay, he's had anxiety. Anxiety is related to, it's an emotion that we have in the body that is expressed. It can be neurological. It can also be related to certain organs. In Chinese medicine, through ancient studies of patterns over history, they've learned that anxiety and depression and anger is frequently related to the liver organ. So when you say to me anxiety or depression, I'm thinking, okay, I'm going to be working with the liver. So I know that already. You also said shoulder. Well, this could be some of the anxiety or stress that you're dealing with, so you could be holding more tension in the shoulder. So part of our treatment on the liver would reduce some of the tension in that shoulder and in the muscle, okay? But also on top of that, there are certain points that are specific for the shoulder that I'm going to address, and that'll be down here in the lower leg.
So interesting, and I feel like as I come in, you can just get a read on me too.
Yeah, we check you, and some of the other things that we like to do, we like to check the pulse sometimes. And we don't always do that, but I like to frequently. Or we'll check the tongue, okay? And the tongue will give us a very good indication of certain measures. It's the only exposed muscle of the body. So you have an exposed muscle, it gives you an indicator for what might be happening to all the other muscles in the body. If it's pale and really faint, then maybe there's not enough blood supply, or maybe the patient's experiencing some fatigue. If it's really purplish or dark, well, maybe there is stagnation in the body and too much or potential of clotting or cloying. And so we'll need to focus on moving the blood in those instances. So checking the tongue can be helpful. Looking at the eyes, if you notice redness, there could be a heat pattern like fire, or what we in Western medicine would call an infection, potential infection initiating. Or if there's yellowish tint to the eye as well, obviously that indicates some sort of liver-related issue. People frequently call it jaundice, right?
So what is happening now?
So right,
I feel like sometimes, and I know people want the scientific, but there's an art to what you do as well. Let me take my watch off.
It's okay, actually. Okay. So what we're doing now is we're getting a read for where your energy is and which organ systems I need to focus on. And so definitely liver is the one that we need to focus on. That's a secondary check, checking the pulse. We can see which different organ systems might be off. And yours is saying to me, yeah, we need to address liver.
How do you know that?
So we're going to focus on liver today,
okay,
and then we'll put some points in, extra points to help your shoulder.
Okay.
Okay?
And is that part of the artistry that all of your years of experience and study tell you?
Yeah, so there are acupuncturists who are way better than me at pulse checking. And some of them will only, in fact, some acupuncturists or Chinese medicine specialists will only check the pulse, and they'll spend maybe 10 minutes just holding your pulse and checking the levels.
Wow.
I went in to buy some herbs at an herbal store when I lived in California. And when I went in there, I was looking for an herb called Ban Xia. And I asked the desk, I asked him, you have Ban Xia? And they look at me like, oh, do you have Ban Xia? And they're like, do you have Ban Xia? Do you have Ban Xia? And nobody could understand. I think it was me, my accent. I couldn't.
It was probably you, right?
Yeah, I couldn't pronounce it properly, and I was trying to, Ban Xia, Ban Xia, Ban Xia. I tried all different ways. I couldn't pronounce it properly, at least not for them to be able to understand what it was. So eventually, as I walked past this table, and there was this person checking the pulse. You sat at a table, and there was this nice pad, and the person's wrist was laid on the pad, and then they were checking the pulse with their hand. This was a specific pulse reader. And he was getting a sense of what was the deficiency, what were the excesses in that body, so that they could make an herbal prescription for it, which is pretty cool. So there's a sophisticated balance and a real art to this process. Anyway, I went to go look for the Ban Xia. Okay, I went to go look for it. It's Pinella, by the way. I went to go look for it, searching through all these shelves, trying to find it. Finally, I come across it. I'm like, oh, there it is. I found it. And I went back to the place, and I showed it to them at the front desk. I was like, this is what I needed, Ban Xia. And they look at it, he goes, oh, Ban Xia, he needed Ban Xia. And they were all like, oh, it was Ban Xia. And I'm like, my ear is hearing the same thing, but totally different. It was a funny story.
That's an interesting story of just part of your life journey.
Yeah, for sure. And that was when I was in school, and I was I went and drove up there because my son, my child, was having a lung-related issue, and so I needed to get some of this to resolve some of the phlegm from the lung, to the congestion. And I was able to make a tea for him on my stove in my apartment, and then resolved that issue for him. So I rode up there on my scooter and got the Ban Xia, and away we went. It was fun.
Wow, how long ago was that?
That was, 20 years ago now, almost. Yeah.
So that's part of your journey to get you here. So you're not just some guy who started doing this yesterday. This has been your lifelong.
Yeah, I like to be jovial. I like to interact and have fun in the clinic, and so I'll joke with patients and let them know that I'm just starting this. This is my first time.
Right.
But
great
yes,
when you put needles in them to tell them.
Yeah, it's like, oh, by the way. Or usually we stand back. We like to say this. We'll stand back here and just throw the needles in, right? That's,
like darts, yeah.
Yeah, that's one that patients really appreciate when it's their first time. But no, we like to have fun. But most of all, it is a serious thing. It is art. It's our health. Right? And we want our patients to be well now. And the jovial aspect, the enjoyment, is really that we want to have joy in life, and I want you to be able to experience that as well. And my aim is to be able to achieve that with our patients, that they can not just live and suffer through life, but to find joy in life as well.
Well, I feel like my life has been better since I started coming to your community acupuncture. So as you're doing the alcohol swabs here, I think, or whatever you call it, and you're about to insert the needles, talk to me about what is happening, right? There are meridians, there's
Yes.
organs that you're trying to connect. Like, what is happening with acupuncture?
So I like to describe it in a way that makes sense in my Western brain, you could say. There are meridians. In acupuncture, we call them meridians. In Western medicine, we don't know what that means exactly. But essentially, it's communication pathways through the body. Just like we have highways, we have residential roads and streets, and then we have freeways, and there are intersections. Well, we're looking for those major intersections that connect in a big way to different cities or organs, right? And if we can have an impact in an intersection to release stagnation or traffic, if we can clear that traffic, then it's going to improve the function of those organ systems, okay? And also the nerves. It's going to improve the function of the nerves and the nerve pathways. And so really, when I say meridians, what I'm talking about is nerves. I want to have an impact on the nerves of the body that communicate to the brain and send signals to the end organs. And if we have this major command center, the brain, which commands everything ultimately, the heart rate, it commands the release of hormones, the production of serotonin, and the availability of acetylcholine, a variety of different things. It even works with our gut-brain balance. We know there's a big communication between the gut and the brain as well. So if we can have an impact on the brain, we can literally have an impact on almost any health ailment or condition. So by following the process and the pattern, we say, okay, let's break this down. So instead of treating all of this, we say, okay, what are the patient's most pressing concerns that are going to have the greatest impact today? Because we want them to be well now.
Now, have you put any needles in yet? I feel like I'm already...
No.
I see. Is that
You're
weird?
receiving the care already.
No, but I feel like I've already have them in me. Like, there's something to a placebo effect, right? By being in here so many times and like...
Yeah, so
what's placebo, what's not? You know, and again, I'm kind of off topic, aren't I? Because...
Yeah, but what you've done is you've gotten yourself into the behavior of receiving the care.
Is that part of what you say when you say acupuncture is a practice?
Acupuncture is a practice, yeah. So you come in receiving that care, receiving healing. That's part of what acupuncture is teaching your body to do. Well, how do you receive healing? Well, you have to have a balanced state. It's like when you rest, when you sleep, you're in the best state of healing. Well, it's because you're in more of a balanced state and able to receive the healing. So acupuncture is coaching you, teaching you, okay, this is how it feels to be in that state. And then your body can more aptly and ably get there in the future.
Wow. Do you think that the people who say there's no science to prove acupuncture works or does anything, do you think they're right?
No, absolutely not. There's a lot. Thanks for teeing that one up for me.
I wanted to give you a leading question.
Yeah, but we know for certain that acupuncture stimulates the nerves, and we know it's specific to certain cortical regions of the brain, which is super cool. Like, name anything that you can do. You can have a specific impact to a cortical region of the brain and impact that organ system by doing anything on the body. What can we do? The only thing that we know of is acupuncture. So we've put patients under MRI imaging, functional magnetic resonance imaging. You can actually see these bright colored lights as the brain is activated. You can tell the person, here, perform this math problem. You can see which cortical regions of the brain are being lit up in order to perform that function. Okay, so that's cool. Well, what if we take it, instead of having them do math problems, what if we have them do acupuncture? And we can do specific points and see which cortical regions are being lit up. Okay? So what they've done, those specific tests, they blindfold patients and they say, okay, now let's get a needle and put it in a point that's supposed to be good for the eyes. And so we put it in that point, and the visual cortex, which is in the back, the occipital lobe of the brain, lit up. Okay? And it was the same, essentially, as shining a flashlight in the eye, which meant it's going to have an impact on the optic nerve. It's going to have an impact on vision. It's going to have an impact on that portion of the brain. So any of the other organs or related systems that are going to impact your eye are also going to be able to be influenced by putting those points in that affect that cortical region of the brain. So we've seen that and demonstrated it through MRI imaging and testing. We know what functions through the brain. We know what functions through the nerves. How exactly it works or why exactly it works, maybe that's what we're still trying to figure out. Okay, but that it works, we are not trying to figure out. We know it works. We just maybe don't understand fully how or why.
And you've got these heat lamps, which maybe people are like, what are those alien-looking, those are heat lamps?
Yes.
And does that just make me feel better because my feet are warmer, or what? Why have a heat lamp?
So I like to use the infrared. I like to use the far infrared and the near infrared because it helps to activate ATP synthesis in the body. So it will improve energy and blood flow and circulation, but it will also speed healing and tissue recovery in the body. So I like to use the infrared heat lamps.
Whoa, very cool.
Yeah.
How long has acupuncture been practiced?
Well, that depends on who you ask. So our professors have said anywhere from 1,000 years to 5,000 years plus. You can definitely go back, and there are ancient writings as old as about 2,000, 3,000 years ago even. So you can find ancient writings where they've described acupuncture techniques or acupuncture formulas that they utilized for specific conditions. So acupuncture has been utilized for a very long time with its component Chinese medicine, the herbals. It's been used in conjunction with herbal medicine as well for thousands of years, and it's been the main go-to primary care medicine for one of the most populated regions on Earth for millennia. So it's lasted the test of time, let's put it that way. And so I think with that, what is a really good trial or a really good test? A really good trial is set up properly where you have a blinding, so somebody can't really know which treatment they're receiving, and then it's double randomized, and so you have all of this randomized. You're trying to get rid of all of the potential bias in the study. Okay. Well, the other thing, let's say you set it up really well. There's biases that find their way into studies regardless of how much you work to get them out. But the other thing that is particularly indicative of how well something works and how good it is over time. So now the length of that study, how many years was the study done for? And does it continue to be repeated and validated over time? Well, if something is repeated and validated over time and consistently proves beneficial in its results, then that is the greatest science that we have. So ultimately what I'm telling you is, in my opinion, acupuncture actually has a lot better science than any current, present, modern day pharmaceutical drug that is on the market, period.
It's getting a little harder to follow you. I find myself getting a little fuzzier, a little more relaxed.
You're resting.
No. But
we're supposed to be turning the lights down right now for you.
So what is happening in my body now? Like, I felt the little ping as you put the needles in.
Yeah.
I feel kind of like a very warm, well, the lamp is warm.
Sometimes people feel like a movement. They'll actually feel the transferring of the synapses. They'll actually feel it moving through their body and communicating with their brain. What's happening is your body's being balanced, right? We're finding those areas of stagnation or where there's a buildup or a dysfunction in the nerve pathways, and we're clearing those. And as you start to clear those, you go, wow, my body's functioning more optimal. And if your body's functioning in an optimal way, then you can know for certain that, okay, well, if I need to digest and eliminate, I can do that. But at the same time, I can perform high stakes requirements or tasks as well. So we should be capable of resting and digesting and performing high stakes tasks simultaneously, right? We should be able to do this together. And we get ourselves into a situation in life typically where it goes like this. We only become capable of one of them or the other. And that's where there's a major dysfunction. That dysfunction can shut off certain processes that should be performed in the background almost without our knowledge, such as the heart beating, right? And then maybe you get it to such a significant place that you develop tachycardia or a racing heartbeat, right? Or maybe bradycardia where it slows down, or irregular rhythm. All of these things are regulated by the autonomic nervous system, which is the nerves of the body, the brain and the nervous system, regulating heart rate. Well, your digestion is regulated that way too. So if I'm in a constant state of fight or flight, rest and digest, and it's instigated by monsters or energy drinks or whatever else, and I'm not getting to this place of balance and rest, then what's going to happen is I'm eventually setting myself up for a disease state. So right now it's just dysfunction because that's what I'm perpetuating in my daily activities, but eventually I'm leading to a state of disease.
How does acupuncture help for anxiety then?
So with anxiety, there's a variety of things with anxiety that acupuncture can benefit. So anxiety, you have a lot of racing thoughts. Sometimes it's palpitations, it's your heart, it's irregular heart rhythms. Patients even can have a full-blown panic attack where they feel like there's a constriction over their chest, and they like someone standing on their chest ultimately. So this amount of tension is, I would say, you want to relate it to like an electrical conduit, and you see it dysfunctional, or maybe there's a cut in it and it's sparking, right? And that's what's happening here in your chest. Your body is not functioning appropriately. Okay, so this can be related to serotonin release in the body. It can be related to the availability of acetylcholine in the nerves and the neural cleft itself, so it's not transmitting those signals as well. So we're not transmitting the signals, the muscles aren't able to relax, the vessels, instead of dilating and relaxing, they constrict and the blood pressure goes up, right? So that's anxiety. Acupuncture is going to help with anxiety by saying, okay, we're going to jump into the root of what's making all of those things act in a dysfunctional way. So that is the nerves, the nervous system, the brain. So we're going to tap into the nerves and say, okay, we're okay. Let's fix this dysfunction over here where the cord, electrical conduit is sparking. We'll clear that up and get those transmissions moving efficiently now. And now what you're able to do is think and process better. You're able to digest better. Your heart functions better. And all of the organs in the body are receiving the signals and the messages from the brain and the nervous system in an ideal and optimal way.
Is there one condition or one patient that is just absolutely ideal for acupuncture where you wish more people knew about acupuncture or would try it because the results are just mind-blowingly amazing? For me, as a maintenance thing, because you offer a very affordable community acupuncture where it's like, it's not a one-on-one thing. You can come in with a group, everyone's quiet, everyone's friendly, and you can get a punch pass, right? It's a doable thing for somebody. You can make it a part of your routine. You offer different times a day during the week. It's a very doable thing if you make it a priority. And I just find it's a nice, relaxing maintenance thing. And I don't have to overthink it and know how it's all working. I just know people like to know these things.
You just come in and do it.
Yeah,
you just come in and do it. It's for your health. It helps you to be well now, to be better, to be happier, to be healthier. Overall, it's balancing. So I have patients come in for back pain, for shoulder pain, for headaches, migraines. I had a patient in yesterday. We've done multiple inductions, so labor inductions. So they come in for a variety of things. What's the perfect candidate? Well, if you're feeling like your life is a little bit off and you're feeling like you're not balanced, and maybe you're one of those people that have been to a care provider or a doctor and they've drawn your labs and they're like, there's nothing wrong with you, everything looks fine here, but you keep saying in your mind, something's off. This is the perfect place to be. Acupuncture is the perfect care for you. Chinese medicine is the perfect approach for you because it's more subtle in its approach. It picks up on the variations of dysfunction that are not going to be found in a lab that requires a significant level of variation in order to detect. Okay? So those variations where you're like, well, I just feel a little off, acupuncture clears those up, puts you right back in balance so you can go about your day feeling well and being well now.
Is it weird that I feel like my body wants to move a little bit? Like I feel like certain things, what's happening there?
Yeah, so that's really interesting that you mentioned that. Energy will move because it's being pushed through the body. We're sending signals through the body. Sometimes that moves through the muscles as well. So when it moves through the muscles, you'll feel it and you'll need to move or initiate a contraction in that muscle. And that's okay. It's okay to do that. But what's happening there is that the nerves are sending the signal to the muscle that there's some dysfunction there, that there's some stagnation. And just like we exercise, we go out for a run and it makes our muscles feel better. Sometimes it makes them feel sore too. But we get a pump, our mood is lifted from being outside and from running. We have these happy hormones, right, that are released when we do that. Even just slightly moving that muscle that the acupuncture is telling you, hey, you need more movement here. You need more activity here. So you do a little bit of movement, activating that muscle, and then it will release that stagnation and calm that down.
What's the sweet spot on time here? How are we doing on time? What's a good amount of time?
I did not put you on for time, so I guess it's up to the viewers. Why don't you guys all just comment right in and see how long we should leave Nick here?
What's the longest you could leave someone, Frank?
I'll put needles in sometimes, and people could stay for an hour. People could stay for over an hour if they need to, but typically I would say 20 minutes, 15 to 20 minutes is like the minimum, the base. If we're dealing with a child or a kid, it could be less, it could be 5 to 10 minutes. And if we're dealing with an adult, I would take it up even on a maximum, maybe 45 to an hour. You don't need any longer than that.
Wait, so you could give kids acupuncture. Can you talk about that?
For sure, yeah. So we do acupuncture a lot. We do it for children, for bedwetting, to help with the kidney plays a significant role in the urinary bladder and the sphincters that close and open in order to control urination, right? So enuresis is bedwetting, or the release of the urine flow at times that are not ideal. And so we want to be able to help children to have control and like a connection between the brain and the body. Acupuncture helps them to achieve that. So we'll use acupuncture to treat children for that. We also use acupuncture to treat children for lung-related issues. And we use other, like breathing treatments that we've talked about, ozone and different things in the past also, to address that. But acupuncture is one that can help nourish the lung and support the lung so that you can actually have better nutrient exchange in the lung as well. So you're getting more oxygen to the cells. Patients with allergies, sinusitis, upper respiratory issues, all of these things that kids deal with, earaches, right? We can use acupuncture for those things. And kids do tolerate acupuncture fine. Some of them are deathly afraid of needles. And I understand with our society that people have a fear of needles. That's just part of what comes for a lot of people. In some cases, I'm able to work with them and we can get past that and that's fine. And they realize, oh, it's no problem. These are just little pins. They're nothing like having a shot or an injection.
Yeah.
But in other instances, it's something we have to work with. And so we can do like acupressure, we'll massage points, or I have a little electric, I call it a piezoelectric generator, where we can put a little electric sensation into the point a few times and then move to another point and put it in as well. So we have a variety of approaches for working with kids in ways that are safe and also amenable to them.
That's awesome. How are we doing on time?
I think you're probably done.
Yeah, you think?
Probably good. Yeah.
Should we do it all encompassing? Get it in, get out. Okay. So this has been incredibly relaxing. Feels so warm and fuzzy, like I could just like lay here forever. So now we're getting toward the end.
Yes.
Like, does it shock the body when you take the needles out? Talk to me about how.
So when we remove the needles, sometimes there's little fibrin, like muscular tissue, that will wrap around the needle and hold it there. And sometimes throughout the treatment, that will relax, and the needles will bend down, and you'll see them kind of lay down a little bit, or sometimes they'll even just fall out on their own. If that's not the case, and it continues to stay wrapped around there, we can pull that needle, and sometimes it'll feel like it's a little stuck, and so it might be more on the way out. Usually we don't have that issue. That's very rare, that it's like you're pulling against the needle and it doesn't want to come out. But we'll just pull out the needle. Usually they get to this point where they're very relaxed. We pull them out. It's hardly noticeable at all. And then you go along your way. And typically the acupuncture treatment itself continues to work in the body for about 24 to 48 hours.
Really?
Yeah, so it's pushing through this nerve pathway, and to move through each of the channels, the organs in the body, is about a 24-hour cycle. Okay, so each of the organs is going to have a different, it's going to be focused on each organ at a different time. And so moving through each organ takes about 24-hour period. And so the acupuncture can be continuing to have its initial impact for that long. Now, whether you hold the resonance or the understanding of how to get your body back to that point, that's the practice of acupuncture. And that's why we say it's important to do it on a regular basis. It's important to kind of be a coach or treat it like a coach, because acupuncture is teaching your body to be in balance.
Well, shall we end it there?
Sounds good to me.
Thank you, sir. This was a wonderful experience for me, and a hopefully helpful podcast for folks out there. We want people to have better lives, and that starts right now.
Be well now.
Namaste.
Namaste.